Congos, come with me now on the new morning show. It's new 92, 7:39. Zuchin Korean with you. Weather out there today, rain in that forecast with a high of 67. Then tonight we'll drop down to a low of 59. Tomorrow, clouds and a high near 71 for your Friday. In the studio from Relf Eye Care Specialist, we have Dr. Relf with us. How are you today?
I'm fine, thank you.
Today we are talking about glaucoma. And I thought I knew what it was, but I had the wrong guess. I had guessed cataracts is the description I made. But glaucoma, what is glaucoma?
You are not alone. Many people think they know what glaucoma is, and when it comes right down to it, they actually don't have much of a clue.
Yeah.
So the easiest definition and the simplest way to look at it, glaucoma is a disease where the pressure inside your eyeball is high enough to damage your optic nerve. The optic nerve is the little cable that goes out the back of your eyeball and it plugs your eyes in up into your brain where you actually see things.
Right. Now, is this something that comes on when you're older in age, or how does that work with glaucoma?
The most common type of glaucoma, which is what we'll be talking about today, is something which usually presents later in life. Maybe we start looking around age 50.
Okay.
Rarely a little bit younger, but usually we'll start watching people more closely around 50. However, we can see people at an earlier age, and just by examining their eyes, by looking at their optic nerves, realize that there's somebody that is at risk of getting this as they get older, and we can recommend appropriate screening for them just based on the appearance of the optic nerve when we examine their eyes. So that's part of a good eye exam, is a real good look at the optic nerve and a discussion of how strong and sturdy it is. Mm-hmm. A lot of people have the idea that if their pressure is in the normal range, they're fine, and that's really not true. About a third of the people going blind from glaucoma have pressures that are in fact within a normal range. And you say, well, how could that be? It's because their optic nerves are very fragile. They were unlucky. They were born with fragile optic nerves. Oh. They don't need a pressure that's normal. They need a pressure that's at the low end of normal, or maybe even below normal levels. Yeah. In other people, it's the opposite. They're lucky. They were born with very sturdy, strong optic nerves. They can have a pressure that's way above normal. But for them, it's okay because they were fortunate. They were born with healthy optic nerves.
So is there a way to regulate your eye pressure? I mean, how do you do that? It's not, it's like blood pressure or what? I mean, how do you...
There's nothing you can do, and there's really nothing you can avoid. There's nothing you can eat or not eat. You really have no control over that. If we decide that a person is at risk of getting glaucoma, a high risk, or if they already have it, we will lower the pressure by treating them. Typically, we'll start off with an eye drop that goes just once a day, and it successfully lowers the pressure adequately, and then they're fine. If that doesn't work, we can add more drops. We also have some newer laser treatments that are very successful, and most recently we're coming up with some new surgeries that have been very low risk and much more successful than some of our previous glaucoma surgeries. But ideally, you'd rather not have to have the surgery. You'd rather pick it up early, at which point it's usually fairly easy to control with eye drops.
It's amazing the last few years, the technology with eye procedures, how far it's come in the last, 10 years. I mean, it's just amazing. Every year something new. I mean, you guys can do more and more. It's really neat.
Yeah, that's been a lot of fun to see things grow. And glaucoma, frankly, has been a little bit behind in terms of new technologies compared to something like refractive surgery, LASIK, and that sort of thing. But we're starting to now, in the last few years, see some big advances that have been very good, especially given that the aging population, we're seeing more of this as people get older.
If people want to maybe get an eye exam and see where they stand as far as their eye pressure and whatnot, what's going on, where can they find you guys?
We are on Air Base Road, kind of tucked in behind Menards.
Right. And we should mention you guys do everything there too. You can do this, you got your glasses, the contact. I mean, you can do everything.
We see just about everybody for most everything. And if we don't have the capabilities in-house, we're very good at getting people tucked in. We're proud of that.
Yeah. What's the website? You guys have a website, right?
RelfEyeCare.com.
Easy as that. Dr. Relf from Relf Eye Care Specialist. Thanks for stopping in today.
Okay, thank you very much. Nice to chat.
7:43 here on the new morning show. It's new 92.